All right, so the neural tube is like the hollow part that the brain and spinal cord will eventually like come into. It's like the original development, and it happens really early on in utero. Okay, so a neural tube defect would be a defect of that tube where the brain and spinal cord are going to end up forming. So, and there's lots of different kinds. You can see, like I drew you lots of different pictures, JK. So if the neural tube does not close, then whatever develops is going to come out of whatever that hole or that defect is. And that's called a spina bifida. So spina bifida is not really a disease per se, unless you put another name on it. A spina bifida means that there is a defect in that neural tube. And so something is coming out of it, whether it's the brain or whether it's the spinal cord. Do you understand that? Yeah. All right. So for some reason, it's really important for you to know this fun fact that nobody gets enough folic acid. So they started fortifying all our foods with it in 1998. So we saw a decline in neural tube defects in 1998. All right. So the neural tube forms at around 20 days gestation. That is brand new, and most people don't even know they're pregnant, which is why they recommend all women of childbearing age to take 400 micrograms of folic acid daily. How many micrograms? 400. That's right. That's all of you. Yes. You child bearers. Okay. So because at the 4th week, the neural tube closes, but the 4th week, since you haven't had OB, is way before you know you're pregnant, because by week 4, right, it's not 4 weeks pregnant. You'll know like the weeks go based off your last menstrual period. So like, let's say you started your period today. Okay. In 2 weeks, you're going to ovulate. And you'll get pregnant at that time, but you'll have no idea. I mean, obviously, you'll have absolutely no idea. And a pregnancy test won't detect that. So 2 weeks after that, which would be when you're about to start your next period, or you haven't even started it yet, is when you would be considered, like, I don't know why I went like this, 4 weeks pregnant.
Oh, wow.
So you see, most people wouldn't even know that they were pregnant, right? That's why they're like, oh, they added it to all of our food, like cereals and things like that. Okay. So, all right, risk factors for neural tube defect. It's not just from folic acid deficiency, though it could be. B12 deficiency can also cause that, because B vitamins. Healthy nerves. Look at that. Bells. All right. Maternal malnutrition. That's only because they're not taking in enough folic acid and B12. All right. There are other things that can put you more at risk. Now, drug use, I think, is because they typically tend to be more malnourished, because they'll usually use instead of eat. Y'all know people that use drugs a lot are very thin. Yeah. Okay. Radiation exposure, chemicals, genetics. If mom has type 2 diabetes, or mom is obese, or both, that just puts you more at risk, but it's not causal. You understand this? Yes. Okay. So let's go over the different types. I don't have my glasses here. I'm gonna have to read them to me because I'm getting old and I can't see. Okay, so I'm going to cover like the big ones that you may see. Anencephaly. We actually have a lot of babies that are born with this. Really sad. They don't really have a brain, because Anne means without, huh?
Amelia's baby, right?
Yeah.
Amelia's baby. I don't remember.
Her baby
that.
has
Is that like Zika virus?
No, Zika just causes like microcephaly, so a small head, but they still have a brain. So you see that there's no skull there, and yeah. And then an encephalocele, anytime you see ocele, that's a protruding of something, right? So enceph means brain, right? And then ocele, so the brain is, that's correct. Okay, well, that's not very good. The other ones you may see is spina bifida occulta. You will probably not even know the kid has it. So what does occult mean?
Hidden.
Yes. So the defect is
Hidden.
That's correct. Yeah.
Wow.
So you can't see it. There's some signs and symptoms, so we'll go over those. So you see the ones in pink, those are the signs and symptoms of spina bifida occulta. So there's a defect in the spinal cord, but the skin is covering it, like you can't see it at all. So most of them we don't catch until they start toilet training or lack of toilet training, because you wouldn't really know because you can't see it. So they may have a sacral dimple, which is like a teeny tiny little dimple right above like where their butt cheeks meet. Because it shows like, hey, there's a defect there, and all you can see is like a teeny tiny dimple. Okay. A little tuft of hair right there where the dimple is. So if they have like a little tuft of hair right above their little butt cheeks. A lipoma. Do you know what a lipoma is?
Like a fat cyst?
Yes, a fat cyst. Okay, that's good. Yeah, a fat cyst. They may have a little more weakness in the feet. They may fall a little bit more often, bowel and bladder issues, but it takes like a long time to diagnose that, because that's not the first thing I guess I would think of unless you saw any of those signs and symptoms. Okay. Usually it's between L5 and S1. I don't know why that's important, but it is. It's a lot more common than you think. But like I said, we usually don't catch it till they're like preschool age, sometimes up until school age when they start having accidents, and we know that that's not normal, right? All right, the other big two that you're going to see, y'all can look at the other ones too, but I'm just going to cover like the big ones you may see. Meningocele and myelomeningocele. And these are the two that we really need to focus on today. Okay, so the meningocele is when the meninges, what are the meninges?
The layer of the brain. They cover the brain.
So protective of the brain and spinal cord, right? So those meninges, which have cerebral spinal fluid in them, will go through that defect. So the hole is big enough to where it can actually protrude and you will see a sac on the outside. Okay. So the sac is filled with cerebral spinal fluid, but there is a hole. So that means that there's like, what happens if you pop the sac?
It would just all pour out.
Yeah, but then there's going to be like an opening directly into the spinal cord, which puts you at high risk of
Paralysis.
oh, actually, that's true too. Paralysis is true. Infection, like what?
Meningitis.
So your job is to not pop the sac. You have one job. Okay, that's your job. And then the myelomeningocele is worse because that not only includes the, it's got cerebral spinal fluid, but it also has all of the nerves in there. So that would lead to permanent paralysis, right? If you popped that sac and destroyed the nerves, because once you destroy nerves, like that's it. So in these, you will see like a visible sac, both of them. Okay. Flaccidity. What is this? So their lower extremities would be flat because it can be below that lesion, right? So their legs are usually like they don't move much. They're not totally paralyzed, but they're just way weaker. They usually will have incontinence because obviously bowel bladder is below that level, right? Decreased lower extremity reflexes, and they will probably have a neurogenic bladder, which is
They can't feel where they need to go.
a neurogenic bladder, like, yeah, they don't feel, but there's no communication between the bladder and those nerves. Like we feel like we need to pee when the bladder stretches, it activates the nerves and then you need to go. They don't feel that, right? So they'll either get like the neurogenic bladder can just fill and then spill over. We'll see that a lot, or it can spasm and then just kind of leak. So they have permanent incontinence. Okay. Myelomeningocele can exist with trisomy 18. What did I teach you about trisomy 18 yesterday?
Incompatible.
It's incompatible with life. Okay. All right. Do you know what bacterial association is? Okay. What are you going to learn today? So Emmy has this. So bacterial association, they used to call it a syndrome, but it's not really a syndrome. It's just a set of defects that usually occurs with spina bifida, especially meningocele and myelomeningocele. Now she didn't have either of those. She had occulta. But you don't have to write this down somewhere because it's an acronym. All right, so these are things that usually happen, like common defects that happen with these defects. So since this is happening midline, what do you think, what's going on? Defect of midline? Didn't we talk about defects of midline?
Like other defects?
Because it's a failure of
The omphalocele?
Yeah. Failure of midline fusion means when they have a spina bifida, you need to look at the back and you need to look at the front because it's probably some kind of failure of midline fusion. Okay. So bacterial stands, the V stands for vertebral abnormalities, which would be, of course, the spina bifida. The A, or you want to guess? Yeah, let's guess. Okay, so I'll tell you this one. It's anorectal. Anorectal. So they may have imperforated anus or misplaced anus, or I'd say those are two probably most common.
Which one? Imperforated and what?
Or misplaced. Yeah. See? That one's easy. Oh, just kidding.
Cerebral.
Cardiac, yep. Cardiac defects, usually ASD or VSD. T. More scientific. What is this right here? Okay, so tracheoesophageal fistulas. Don't know what those are.
Is there like a connection between the trachea and the hallway?
A hallway between the trachea and the esophagus. So what happens when you feed a baby with TEF?
Yeah, that's great.
I mean, they're going to start choking and turning blue and gagging because it goes down the esophagus and right into the
Lung.
trachea. Yeah. Oh, yes. And into the lungs. You're right. So you cannot feed that baby obvi. They have to be NPO. Yeah. And they have to have surgery to close the hallway. Okay. Oh, that's TE, tracheoesophageal. R, renal. And then L is limb abnormalities. So usually have to have at least 3 to diagnose Bacterial. Then spina bifida cystica is where there's an actual cyst that forms instead of just the sac, that an actual like you know what a cyst is? What is it?
Isn't it just like
It's like pus.
It's not pus though. What is it?
Like serous fluid.
Sometimes there's a little serous fluid, but a cyst basically means you're shedding things inside when you normally would shed them outside. So like we shed skin cells and white blood cells and things like that on the and bacteria on the outside. It grows inside, which is why the cyst continues to grow. Okay. All right. So do you understand the different types of neural tube defects? Okay. So we will diagnose them with an MRI of the spine, which is really difficult to do in these babies. They have to be sedated because, you know, for an MRI, you have to be like super still. So they will sedate them, like full sedation. And then if you think that there's an occulta, you can probably just try an ultrasound at the sacrum and you'll see that there's an actual like hole, but you can only see it on the inside. Okay. But if I need to look at the full spinal cord, which I do, they'll have to get an MRI. All right. So let's fix it, shall we? There's a lot of red flags on these. Let's start with those. All right. Number 1, they go on latex precautions from birth because these babies are in the hospital all the time. Like Amy had 5 surgeries in the first year. So they're in the hospital all the time exposed to latex. So from birth, we put them on latex precautions. Y'all need to remember from nutrition, there's cross allergies with, don't look at your papers, chestnuts. Okay. So I'll just tell you so y'all don't remember. Bananas, kiwi, avocado, chestnuts. So you have to put them on latex precautions and make sure you know that there is a cross allergies. They can't have any of those things either. So be really careful about questions like the baby's in the hospital for neural tube defects. Which of the following would you be like, oh my God, somebody brought them balloons? You know, how about not? You know what I mean? Okay. And they need to wear a metal or a bracelet if they have a latex allergy. Okay. So you can buy a big fancy one that costs like $25 and then your child never wears it. So now your number 1 job with these babies is don't pop the sac. So we lay them prone with their head turned to the side. And then they constantly have like urine leaking and stuff, right? So we just put the diaper underneath, but we don't secure it because you can't secure it or you'll pop the sac, right? Don't mess with their butt. Okay. Leave their butt alone, like no rectal temps. Okay. Because if you put rectal temp in there, they're going to push and that's going to put pressure on the sac. You done popped it.
Do they
Oy.
put pressure if they poop?
Yes, there is. So, but usually the babies are okay. That's why we really encourage them to be breastfed because breastfed babies don't push as much as formula fed because it doesn't have iron in it. But sometimes you don't have a choice. And you can still feed the baby. You just lay down on the bed and then just pop your poop out and then let them feed that way. Because you can't obviously hold them any other way, right? So yeah, so your job is not to pop the sac. No rectal temps. Now you need to watch their FOC. We do this with feeding. So they'll order an FOC Q3. You do it right before they feed because there's such a high incidence of neural tube defects with hydrocephalus, which makes sense because nothing's draining correctly, right? So we have a lot of our neural tube defect babies also have hydrocephalus. So it's something you need to watch for. So if you start seeing an increase FOC at all, any increase, then we're like, hello, you know. All right, highlight. To make sure that the sac does not pop, you're going to cover it with a moist, sterile dressing. So you will wet like a 4x4, a couple of them probably because the sac is usually big, with normal saline or sterile water, whichever one they want to do, and make sure it is a non-adherent dressing. Obviously, you don't want it to stick. That would be terrible. And you keep it covered because you got to keep that sac moist. If it gets dry, it will pop. Okay, they're at high risk of meningitis because they have an open spinal cord. Do you understand that?
Yeah.
All right. So let's fix all the other issues. All right. So for urinary, you understand what a neurogenic bladder is.
Yes.
Okay. So we keep the diaper open under the patient, but you usually will get an order to straight cath Q3. Everything gets done Q3 for these babies. We do an FOC, we do the Folic cath, and we feed. Okay. It does need to be sterile, obviously, but they're eventually going to have to learn to cath themselves. At what age can kids start to cath themselves? I already asked you this question before and y'all said something weird. So let's see what you do this time.
8.
18
months.
Ma'am.
Sorry.
Damn. I mean,
8 in there. That's fine.
Yeah. All right.
I know. I was like, I knew that.
So you do need to watch for UTI because of the neurogenic bladder, because a lot of times they just have overflow, right? Now, when they get older, they usually don't do it sterile anymore because you really can't. And a lot of people will have to reuse their catheters, which is super gross, but they'll like throw them in a pot and boil them or put them in the dishwasher because insurance never covers enough. Yeah, it's kind of gross. I know. I get it. I get it. Then our other option is the Metrophenol. I talked to you about this before. What's the Metrophenol?
The hole in the abdomen.
Yeah.
And then when their bladder fills up, it covers the hole.
Uh-huh.
So they have to stick a cath under and then lean over the toilet and pee.
Very good. That's a Metrophenol. And they can do that by themselves at around 8 as well. Okay. So that way they don't, because can you imagine how hard it'll be to self-cath at school? Have you ever sat on a school toilet? They're so small. I've been up at ME school literally every day this week because, end of year stuff. Oh my God. I have to show you what I did. Okay. So the security is very hard, right? Like it's like very serious, right? At the schools. So I put my ID in my back pocket. And then we were going to do the talent show and I played guitar for her. And so I was like nervous. I was like, let me pee before I pee myself up on stage. And so I sat down and then I got up. And when I got up, I saw my face looking back at me in the toilet.
Oh, your ID.
Oh, it fell in the toilet. I had to reach into a child-size pee-filled toilet that God knows what happened in that toilet and get it out. And she's been telling everybody that story because she thinks it's the most funniest thing that ever was. Anyhow, but it's really hard to self-cath anyway. You got to think like there's a lot of dexterity and they can't do it sterile. And then you're in a bathroom and everyone's, it's just so no, the Metrophenol is a much better option. Anytime this kid has fever, you have to report because it could be a UTI, but it could also be the start of
Meningitis.
Indeed. All right, neuro, watch for increased ICP, right? Because they can't drain that CSF very well. So FOCQ3, report any change. Okay, monitor for hydrocephalus. We do frequent neuro checks and watch those fontanelles. What will I see?
Tense and bulging.
Tense and bulging fontanelles if they start to get increased ICP. Okay. All right, mobility, they all need PT and OT. Now from waist up, they're perfectly fine. And there's no neurological defects, none. They're perfectly fine. I understand what I'm saying.
So
Okay.
it's really just waist down.
It's just waist down. Skincare, very important because the lower extremities obviously are flaccid. So they're like immobile from the waist down. Yeah. Okay. They will need assistive mobility devices. Some of them are wheelchair bound because the spina bifida is really severe. I mean, there's obviously major variation. Like you wouldn't even know that she had it, right? She runs around, she does gymnastics and stuff. And there's some kids who are totally wheelchair bound. So big range. But we want to make sure we do range of motion exercises on the lower extremities. All right, for bowel, this is always an issue. Bowel is always an issue because your body doesn't feel it and it doesn't move very much from the waist down, right? So we are constantly trying to get these kids to poop. Now, a lot of spina bifida kids will end up getting an ostomy that is permanent because they're just like, they can't deal with this thing. Now, there are other options too, but usually if they have the ostomy, they will still have to do enemas. Y'all know you can do an enema through an ostomy.
What? I did not know that.
It's like a fake butthole.
Wow.
Yeah.
I mean, if they're doing it in prison, maybe.
I mean, ostomies are a different ball game here. Did I tell y'all when I told her about her defects? Did I tell y'all this?
No.
When she asked what had happened and like why she has scars and stuff. So she saw the scar in her belly for like the first time. She's never seen the one on her back, so obviously she can't see it. But she was like, what is this? And so I was like, well, when you were born, like the first day you were born, they had to make a hole there and like you pooped into this bag. And she was like, what? And she was like, why? And I was like, well, your bottom wasn't open when you were born. She's like, what? And I was like, yeah, they had to make you a new butthole. And she was like, what? And she was, they made a hole there. And I was like, yeah. And she goes, what color did they make it? And I was like, pink. She's like, how'd they know that was my favorite color? It was so cute. I was like, oh my God, they just knew. They knew you, sis. So anyhow, it was very cute. So bowel is a very big issue and it's very hard. So we will try like fiber fluids, laxatives. Ostomy would obviously be like last resort. Okay. But a lot of times too, since it's failure of midline fusion, especially if they have an imperforate anus with this, which happens a lot, obviously, it will make fissures. So remember I told her like she started peeing out her belly button. Yeah. So did I tell you this?
Yeah.
Okay. So I had to put duct tape on it because I was like freaking out about it. It was fine. Oh, I duct tape everything on her. What? If you've ever tried to have an ostomy on a baby, like they move so much and they're belly breathers, it would not stay on. So an ostomy dressing change on a baby takes like 45 minutes. And I was having to change it like 4 times a day because every time it leaks, you have to change the whole entire bag because it's leaking onto their skin. So I would just be like boohooing, crying in her room, like, I cannot do this again. She'd have to lay still for 45 minutes. It takes 2 people. It was just me. So I was like, oh my God. So I was like, I'm fixing this. Like, this is nuts. So I duct taped her for a while. And then I found skin glue. Okay, this was from Wound Care. Okay, because when I brought her in and he was like, "Did you duct tape her with pink duct tape?" I said, "I sure did." I put like skin protectant on and then I duct taped it on. That was the only way it would stay on. And so he's like, "We know there's a skin glue that you can use." And so I started. It's called Mastisol, by the way. You should totally use it when you get into practice with any ostomy because it keeps the ostomy bag on. I got it to the point where she could keep it on for 7 days. It was amazing. So anyhow, it's just a huge pain to keep on a baby. Mastisol, Mastisol. So yeah, keeping the bags on is just a challenge. It's a really, really big challenge. So for feeding, they have to lay prone. You know, a lot of times we'll NG tube them because they're weak and they're tired, you know, and they're going through a lot. So a lot of times we will do the NG tube feeds for the remainder, but we want to get them PO feeding, obviously. So you'll get that order, that typical order, PO feed for 5 to 10 minutes, kibosh feed the rest, you know. Make sure parents know they can breastfeed. Okay, it is a little more difficult, but it is doable. All right, did I cover everything? Look like it. If you had a kid that had spina bifida or any neural tube defects, then they will they'll take your dose and multiply times 10 of folic acid for the future. So you would take like 4,000 micrograms. Yeah.
If you have spina bifida,
No, if you had a kid that had one, like you want to have another kid, like they'll just like,
double it.
yeah, no, like 10 times it. 10 times it.
Sorry.
Literally 10 times it. All right, do we understand neural tube defects?
Yes.
I feel like I'm missing something, but maybe that's good.
Is that
Okay.
medicine? Is it something you can get out of the Pyxis? Like
What
you need
medicine?
The skin protectant?
Oh, a lot of times you have to order it from supply, but you can definitely do that. I spent so much money on wound care for her to try to figure it out. There's also an adherent dressing that you can buy that's like a vacuum. It's called a vacuum dressing, I think. Her insurance would not cover it because they don't care. They don't even cover enough poop bags. I remember I would call them. I'd be like, "Sir, like she has poop coming out of this hole. Like, what do you want me to do? Just stand there and catch it?" And he was like, "I don't know what you want me to do." So it's like a real big pain to get supplies. But anyhow, yeah, there's a vacuum dressing. So you pull it off and it actually like vacuum suctions to the kid. So I mean, there's all kinds of stuff that we could figure out. It's just expensive to get it to stay. But the dressing, y'all will see when you have one, in the, like in clinic or whatever, they're just a giant pain. They're a giant pain because any tiny leakage, like you have to fix it, it'll just eat away like through their skin. And you have to use a skin protectant. You'll know that, right? I can't believe I forgot what it was called, but there's a really, really good one. I used it like 100 times a day and I can't even remember.
I saw a really tiny class in that, like really tiny.
Yeah.
Because I was on a 28-week-old.
Oh, so it was super small.
She was the one that had everything wrong with her. Like she had DIC. They gave her a PICC line and it ended up puncturing her lung.
Oh.
Like it was so sad. And then she had like a hematoma like forming on her eye. It was really sad.
What in the world? It's crazy.
She